This week's question comes from a lady who wants to know, what is MGUS? What is monoclonal gammopathy of undetermined significance? And what are we doing to try to prevent it from happening? Monoclonal gammopathy of undetermined significance is not a malignant condition in itself, which is the main question that this lady had. It is a precursor to myeloma, but is not a malignant condition. There is a 1% chance per year possibility that this monoclonal gammopathy of undetermined significance can turn into myeloma. So what this means is that after 20 years, 20% of the patients could actually have developed myeloma. And so although it's not in itself a malignant condition, there is an incremental risk over time that myeloma can develop. But the question is the essence of the cancer already there? Well, there are two answers to this question. If you look at patients who have myeloma, virtually all of those patients did have this MGUS, this MGUS, before. So basically 100% of patients with myeloma have had MGUS before. However, as I just said, only 1% per year of patients with MGUS actually develop myeloma. So not everyone that has MGUS develops myeloma. However, everyone who has myeloma did previously have MGUS. And so then the second part of the question is, how do we prevent this from happening? And a key part to this research has been that patients with myeloma do have MGUS before. And then if we look at the timing for that, we realize that this MGUS can have occurred as long as 10 years before the onset of the myeloma. And then on top of that, we can look at, well, what were the factors that could have been linked to that development? And one of the key factors that has emerged is exposure to toxic chemicals. And this has become a very active area of research. And you may be aware of the association that has been noted in the 9/11 responders from New York, in which it's been noted that responders who did have significant toxic exposure are at increased risk of developing both MGUS and myeloma. And so we now have increasing evidence linking toxic exposure of different kinds of chemicals. In this case, it was 1,3-butadiene, a kind of a solvent-type chemical. There are several types of chemicals that we can let you know about that could be risk factors for the development of myeloma. And so moving forward, there is a significant chance that we can come up with preventative strategies. And one of the goals of the IMF is to provide the general public, everyone, with the knowledge to know what preventative strategies could be put in place to try to reduce the exposure to toxic chemicals that might put people at risk.